Hi, I'm Dr. Michelle Cochran, and I am narrating this short program on the current treatments for depression. This program is sponsored by the Neuroscience and TMS Treatment Centers at hopeforyourbrain.com. So today I'm going to be speaking a little bit about major depressive disorder, and I hope that if you like this program, you'll watch the longer program that is on our website. So major depressive disorder is a very common brain illness. In this illness, the pathways which control mood are not functioning. These brain pathways are made up of cells called neurons. Depression has multiple origins or causes, genetic, biologic, psychological, social, but no matter what causes the depression, the outcome or the symptoms that most people feel are depressed mood, defined by sadness, guilt, lack of pleasure, disinterest, low energy, inactivity, low motivation, appetite and weight disturbances, feelings of helplessness, hopelessness, and even thoughts of death, dying, and unfortunately even suicide. One of the most unfortunate things is that major depressive disorder is the most disabling illness in the world. And it affects about 8 to 12,000 people in the USA. And if you think about Middle Tennessee, which is where I'm located, that's about 90,000 people in the Middle Tennessee area. The problem is that most of the people receive care by their primary care doctor, and as good intentioned as primary care docs are, they don't do as great a job at treating major depressive disorder, and unfortunately only about 30% of people actually get well. And that's really, really sad. And about 50% of people don't even go get care. So why don't they go get care? Well, their brain's not working. This is a brain illness, right? There's dysfunction all the way around. You see that image on the lower right is a depressed brain. It's not functioning like a non-depressed brain. So people need help at getting in and getting help. What we know is that the prefrontal cortex is the big problem in major depressive disorder, and the limbic system becomes all hot and bothered and becomes excessively active. So we want to treat it, and the treatments we offer at the Neuroscience and TMS Treatment Center include all these things that you're seeing here on your screen, including things like depression medications, TMS, and esketamine or Spravato treatments, as well as the things that are really common to use, psychotherapy, exercise, etc. The goal is really to get you completely well. So let's talk just a few minutes about medications. So we use them a lot in our office, but we are very knowledgeable with medications. We look for past patterns with meds, things that would be different for a patient to work, and we really spend a lot of time working with the patients to find things that are tolerable. The catch is, what we know is that medications have a lot of side effects. And so we know from studies that the more medications a patient's been exposed to, not only are they less likely to get well, and that data was out of the STAR-D study, but we also know that the more side effects a patient's going to have. And so we know that the medications don't work for everyone, and so we try to offer things like TMS treatment and Spravato after the first medication fails, because that's where they have the best evidence. We find that the patients who are the best candidates for TMS are the patients who have been struggling trying to get well with antidepressants or who have had significant side effects. Certainly insurance coverage for major depressive disorder is important, and many insurance companies pay for TMS after 1 to up to 4 medications fail. So let's talk a little bit more about the details of TMS. It is an office-based treatment, and it's daily for 4 to 6 weeks, and then we taper treatments. With TMS, there is no need for any sort of sedation, and there are no negative effects on memory, and there is significant durability. And what I mean by this is that most people who get well with TMS stay well at 1 year, which is unlike most medications or other treatments. With a TMS device, there is a coil that delivers a pulsating magnetic field, which depolarizes the neurons directly under the coil. These neurons then propagate an electrical field throughout the neuronal pathways, stimulating deep tissues, which then in turn activate the other areas within that same neuronal track. These effects are associated with improvement in depressive symptoms. The effects that the patient feels take about 3 to 5 weeks. Most patients can tell that the treatment is working somewhere between the third and the fourth week. So TMS is a treatment that's given while a patient is awake and alert. Most patients are in and out of the office in 30 minutes. After the treatment, they can drive themselves. They don't have any negative effects on their memory or their orientation. Most patients feel a little bit of discomfort under the coil, somewhere maybe within the first 1 to 3 days. There really aren't any the typical side effects that occur with medications. There is a risk of a seizure, but it is even less than what can occur with some medications. Now, this image you're seeing here is really showing that remission is possible with TMS therapy, and these are the nationwide results. Approximately 60% get to response and 30% get to remission. And I'll toot my own horn here that our office does a whole lot better. So we can get up to 85% response and about 65% remission. And we do this by combining treatments like medication and an intervention called Train Your Brain, which is a workbook that we wrote that is online and being used nationwide by many offices. So we want to get you well. So we do have a very small non-response rate, and in those unfortunate cases where patients don't respond, we work really hard to find other things that work for the patient and are generally successful in that respect. I can't say that in the last 9 years that we haven't been able to help somebody. We really just don't give up, and that's kind of the key to it. So we want you to come experience the hope for your brain and brain illnesses, and hope that you'll reach out and look at our website, call us, talk to us, and come in for a free TMS screener and a tour. I thank you a lot. Have a good night.